Hello, I'm Dr. Sindhu, one of reading doctor here today. May I confirm your good name, please? Nice to meet you, Mrs. Abdullah. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. Is there anything else you want to add? I'm very sorry to hear about that, Mrs. Abdullah, and I understand your worries, and I understand that how stressful situation would be for you. But before I come to the management part, I need to ask you a few questions to better understand your condition. How it sounds to you, Mrs. Abdullah? Mm-hmm. Yes, Mrs. Abdullah. Let me reassure you that a whole conversation will remain confidential between you and me, okay? And nobody else will ever know it, okay? And because a few questions, including some, will be very private and personal questions. Is it okay with you? Thanks for your cooperation, Mrs. Abdullah. So, can you tell me, um, uh, since how long you are trying to conceive? Mm-hmm. And may I know how you are trying to conceive, Mrs. Abdullah? Mm-hmm. Okay. Is it your first marriage? Mm-hmm. Okay. And how about your periods, if they are regular? Okay. And a cycle is of how many days? Okay. And what about amount of periods? Okay. Is there any pain during periods? Before? Okay. Is there any bleeding in between the periods, Mrs. Abdullah? Mm-hmm. Mr. Abdullah, may I know your exact age? Mm-hmm. Have you had any previous pregnancies or miscarriages? Okay. Mm-hmm. And Mrs. Abdullah, if there is any history of discharge from front passage, any history of surgery on lobotomy, are you taking healthy food? Okay, and Mrs. Abdullah, what is your husband's age? Okay, and if he is accompanying you today? All right. Okay, Mrs. Abdullah, what's the nature of his job? Okay. All right, and what do you do for a living? Okay, how's everything at workplace? And how's everything at home? How about your sleep pattern, Mrs. Abdullah? And do you do any exercise? All right, Mrs. Abdullah, if there is any milky discharge from your nipples? And what about your weight? Okay. Have you noticed any excessive hairs on your body or face? If you had any pimple problems on your face? All right, Mrs. Abdullah. And do you have any high blood pressure, high blood sugar, any neck gland problem? Have you noticed any change in your voice? All right. If you are taking any medication prescribed by doctor or over the counter? Okay. If you had any previous fertility treatments? Okay. Right, Mrs. Abdullah. How about your family? If there is any history of infertility, diabetes, increased blood sugar, any cystic fibrosis, any blood disorder like sickle cell disease? All right. And Mrs. Abdullah, how about your diet? Okay. Okay, Mrs. Abdullah, if you undergone any investigation so far? Mm-hmm. Okay, so Mrs. Abdullah, the history we have shared and question I've asked, everything seems to be alright, okay, and normal, but to be on safer side, I'd like to ensure that your ovaries are producing eggs every month. For that matter, I'll offer you a few blood tests, okay, how it sounds to you, Mrs. Abdullah? Mm-hmm. Okay, and so, Mrs. Abdullah, I'm ordering investigation, okay, blood test, and that is FSH and LH hormone levels, okay, and on the first to 5 days of a cycle, okay, when you have periods, okay, and the progesterone hormone level on 21st day of your periods, okay, if it makes sense to you. Mm-hmm. Yes, Ms. Abdullah, these tests do not need any fasting or preparation. Okay, you can get it done anytime. Okay. Mm-hmm. And besides that, I'm offering you ultrasound scan of pelvis. Okay. For that, I'll refer you to the sonologist. Is it okay with you? Mm-hmm. All right. So, Mrs. Abdullah, I forget to ask you. And do you have report if you have any record that you were vaccinated against rubella in childhood? Mm-hmm. Okay, and do you know your current levels of anti-rubella antibodies? No? Okay, so to be on safer side, I'll ask also order a rubella IgG IgM test. Okay, is it convenient for you, Mrs. Abdullah? Mm-hmm. Okay, Mrs. Abdullah. So besides that, I'll encourage you to follow some lifestyle changes. Okay, so I'll strongly recommend you to balance healthy diet. Okay, try to have healthy diet. Okay, and have adequate sleep for 6 to 7 hours. Okay, and I'll encourage you to reduce stress. Okay, you can do some yoga, meditation, and gardening. Okay, and as you stated, your teacher, you can make yourself busy by taking online classes or any tuition. Okay, that's how you can stop overthinking. Okay, and besides that, I encourage you to do light exercise. Okay, and reduce weight. Is it okay with you, Mrs. Abdullah? Mm-hmm. And Mrs. Abdullah, and besides that, I'm offering you tablet folic acid. You have to take it 5 mg once a day. Okay, after meal. Is it okay with you? All right, Mrs. Abdullah. So please come to see me as soon as the reports of test are available. Okay, and I might need to refer you to the specialist. Okay, is it clear to you? Yes, Mrs. Abdullah. Let's hope that everything is fine and you're able to conceive soon. Okay, and I'll advise you to please bring your husband with you next time. Okay, when you come. Okay, with reports. Is there anything else you like to share with me today? Mm-hmm. Okay, Mrs. Abdullah. So here is a leaflet. It includes all the information regarding your condition. Okay, I hope it will be helpful for you, and I wish that you conceive soon. Okay, and here is my contact. Okay, you can contact me anytime. Okay, is everything clear till now? Okay, Mrs. Abdullah, take good care of yourself. Bye bye.